Hi, my name's Lauren, and today we're going to be going over how to perform an anterior nares nasal swab. To start, you're going to want to make sure that you prepare the necessary supplies for specimen collection, which are prepared already. Sterile cotton swabs is what you'll need. Next, you're going to want to make sure that you garb up in proper PPE. For the case of this video, I don't have anything on, but in a real situation, I'd be wearing gloves for actual patient interaction. The next thing that I'm going to do is evaluate the patient by asking, have you had surgery to the nasal passageway recently? And assuming they say no, I'm going to continue to let them know what's going to happen and what to expect. And I'll let them know that I'm going to insert the swab into one of their nostrils to get the sample for testing, and that it may be uncomfortable and they may feel some pressure. The next thing I'm going to do is I'm going to make sure that I sanitize my hands, which I already did previously to this video, but I would make sure that I wash with warm water and soap for about 20 seconds. Next, I'm going to position the patient in a manner that allows for easy access for site collection. So I'm going to make sure that their nose is at my eye level, that they're looking straight ahead, and I'm going to encourage the patient to close their eyes. Next, I'm going to discreetly look up the patient's nose and see if the nose deviates in one direction or like the general direction of the nasal passageway as well. If the patient has a deviated nostril or there's a structural blockage that makes it difficult to obtain the sample from one of the sides, I'm going to make sure that I utilize the other nostril. So next, I'm going to open up the nasal swab, and I'm going to hold it between my thumb and my forefinger, and I'm going to insert the swab about, or at least half an inch into my nostril, and I'm going to insert it into the nostril with the most nasal secretion first. Once I insert it, I'm going to leave it in for about 10 to 15 seconds while rotating it against the nasal membrane. So I'm going to insert it in about half an inch up, rotating it for about 10 to 15 seconds. Then I'm going to take it out, and I'm going to repeat it, but with the other nostril. 10 to 15 seconds as well. Once that's done, you're going to place the swab inside the transport media and store appropriately. Next, we're going to go over the buccal swab for oral fluid collection. You're going to start by preparing the necessary supplies for specimen collection, which in this case is a sterile cotton swab again. Next, I'm going to garb up in proper PPE. If I was with an actual patient, I would make sure to wear gloves, but in this case, I don't have any gloves on for the demonstration. Next, I'm going to evaluate the patient by asking them, have you had anything to eat or drink in the past 30 minutes? Have you used nicotine products in the past 30 minutes? And have you brushed your teeth or used mouthwash within the past 3 hours? If the patient replies yes to any of these questions, then I'm going to instruct them that they will need to wait for the best results. Assuming that they said no, I'm going to continue on to tell the patient what to expect. And I'll say, I'm going to insert the swab into your mouth and collect a sample from your cheeks, and it should not be uncomfortable. Next, I'm going to sanitize my hands using soap and warm water for about 20 seconds, which I already did prior to this video. And then I'm going to position the patient in a manner that allows for easy access for site collection. So I'm going to make sure that the patient's mouth should be about at my eye level, and then I'm going to instruct them to look straight ahead and encourage the patient to also close their eyes. Using my dominant hand, first I'm going to open it, and then using my dominant hand, I'm going to insert the swab into my mouth and firmly rub up and down the side of the cheek for about 5 to 10 seconds. And when removing it, I'm going to make sure that I'm avoiding my teeth, my lips, and other surfaces. So about 5 to 10 seconds. And I'll remove it and repeat on the other side for another 5 to 10 seconds. Then remove it, and then I'm going to place the swab inside the transport media, and store appropriately.